Hello and welcome. And today we are going to be talking about Meniere's disease. I'm Nicole.
I'm Sharon.
And I'm Jasmine.
So, what you'll be learning today is first, we're going to give a little overview about what Meniere's disease is. Then, we're going to talk about some of the symptoms and challenges, then, some treatment approaches, and any extra supports or accommodations someone might need.
So to make it a little bit easier to understand, we decided to sort of present everything in the form of a case history to apply it to a specific client. And so our case is 64 years old. They had reversed hearing loss since first grade, which means that it's in the lower frequencies, and then normal hearing in the higher frequencies. At age 40 in 1997, she was diagnosed with bilateral Meniere's disease. And her current profession is a school-based speech language pathologist. And she has both an uncle and a daughter who have also developed the disease. And so today we are presenting to secondary educational institutions and to school administrators and school district employees. And we are presenting to them because they came to us and asked us to sort of educate them a bit more on Meniere's disease and how they can help their employee. And today we are one SLP and two audiologists.
And now going into Meniere's disease as a whole, it typically occurs in the inner ear, either in just one ear, which is unilateral, or both ears, which is bilateral. The age of onset is typically anywhere from 40 years old to 60 years old, but it can occur at any age. And hearing loss begins in the higher frequencies. And this is considered a progressive disease, so it gets worse over time. And some common signs and symptoms of Meniere's disease are vertigo, also known as dizziness, hearing loss, tinnitus, feeling of pressure in the ear, and extra fluid in the inner ear due to poor drainage, which is known as endolymphatic hydrops. And so in this case, the client initially experienced fluctuating hearing loss, which was one of her first signs. She experienced tinnitus, intense pressure in her ears, speech sounded very muffled, and she was lightheaded and dizzy and experienced vertigo. And currently, she is still experiencing fluctuating hearing loss, difficulty with speech discrimination in noisy environments, nystagmus when exposed to vestibular input, and recruitment, which is an unusually rapid spike in loudness. And some of her main challenges that she's facing is problems with keeping up with all of her paperwork and medical billing. She doesn't have enough time to exercise and relax. And if she's too stressed and not getting enough sleep, then her symptoms will increase. And if she is unable to stream to her hearing aids, then she can't hear someone talking on the phone.
So these are the audiograms for our case. You can see the progression from 1997 to her most recent evaluation in 2022. And as you can see at the beginning, she was able to hear higher frequencies, but unable to hear lower frequencies. And then as time passed, you can see that there's a pretty generalized hearing loss in all frequencies. And this applies to both the right ear as well as the left ear, as you can see right here.
And some special considerations are triggers. So if she experiences a drop in hearing, it will usually be of about 20 decibels, and vertigo episodes, which can be from the following triggers. So the first one can be lack of sufficient hydration, which is also foggy vision. If she skips any meals, this can lead to low blood sugar. And if she's experiencing any stress and anxiety, then higher stress and anxiety levels will lead to more attacks and stronger symptoms. And it's important for us to understand what some of her personal triggers are that can cause her stress and anxiety and help learn how to reduce the severity of her symptoms. And some other triggers include foods with high sodium, aspirin, her menstrual cycle, lack of sleep, and being out in the sun for too long.
And some other special considerations that are applicable to this case is that symptoms become exacerbated when there is insufficient lighting in a room and when students are wearing masks, because she does rely a lot on lip reading when she can't hear something adequately. And she also does have difficulty working on articulation due to auditory inaccuracies. And when triggers result in an attack, her symptoms include initiation of a roaring sound in her ears, migraines, extreme fluctuations in hearing loss, vertigo, impaired balance and coordination, and impaired motor skills and depth perception. And just a little bit more information about the Meniere's attacks. Basically, they are spontaneous vertigo lasting for at least 20 minutes, but can last up to several hours. For our case, she said they usually last about 3 to 4 hours, but she also does not get them as much as she did in the past because she does have good management of her symptoms with the diuretic and dietary modifications. Her symptoms are vertigo, nausea, vomiting, or retching, nystagmus, which is repetitive, uncontrolled eye movements. And then also balance issues can persist for days after the attack. The frequency of attacks also speaks to the severity of an individual with Meniere's disease.
So some of the potential communication challenges, not only this client, but all patients who have Meniere's disease may deal with are poor speech discrimination, especially with similar sounds. So you're unable to discriminate sounds like sit versus fit, day versus bay, very similar sounds, or low tone hearing deficits, which means it's really hard to understand sounds or words in loud environments. And also, um, some patients may have sensorineural hearing loss with Meniere's disease, which causes fluctuations of sounds, where sounds can be presented either too loud, too quiet, or too distorted. So some of the communication strategies are lip reading training, which actually has two subtypes, which first be visual speech perception and the second be word recognition reading. So visual speech perception helps discriminate between the phonemes and you use those clues to help identify the targeted word. And word recognition reading is reading lip reading, sorry, to identify the whole words, and then closed captioning, which is kind of like subtitles, and then also another strategy would be using speech to text apps for language comprehension challenges.
So now on to treatment. Treatment is determined based on disease stage, disease severity, and symptomology. And this is what drives what intervention you choose for a specific person. So the goals of treatment are to provide relief during acute attacks of vertigo, to prevent recurrent attacks, and to eliminate the progressive damage to hearing and vestibular function. However, this last goal is something that is still being researched, and as of now, the progression of the disease is inevitable, and the majority of treatment is focused on management and compensatory treatments.
So one treatment approach is actually diet modifications, and you can get a licensed dietitian to help out with dietary modifications for Meniere disease patients. So some of the dietary modification includes lowering sodium intake, abundant water intake. So it's usually recommended for 35 milliliters of water intake for each calorie of body weight. Oh, sorry, kilogram of body weight. Avoid or reduce alcohol or caffeine consumption. Gluten-free diet also helps a lot. And then increasing the intake, especially processed cereals.
And then for hearing aids, conventional hearing aids fitting isn't necessarily appropriate for people with Meniere's disease because of their fluctuating hearing loss. And it's most useful if they come with a portable programming device, which allows them to sort of adjust their hearing aid capabilities throughout the day, depending on those fluctuations. And hearing aids for Meniere's disease, because of the high-tech nature of them, can also be more expensive than for other auditory disorders.
Another treatment approach are cochlear implants, and it is typically recommended that someone with Meniere's disease gets a cochlear implant before they are 70 years old. And some of the benefits of getting cochlear implants if you have Meniere's disease are it can improve hearing speech sounds at higher frequencies, and you have a higher chance of improving word recognition scores and speech perception if the implant is put in before you are 70.
And then as far as medication, there are multiple medications that can be used for Meniere's attacks on an episodic basis. And this can be motion sickness medication, centrally acting antihistamines to suppress vestibular system and prevent vomiting, medication to decrease neural firing in the brain and vestibular nuclei, migraine medication to mitigate recurrent attacks. And then the one medication that is indicated for daily use is oral diuretics. They are most commonly the first line of treatment, and they improve fluid regulation in the inner ear, as well as decrease frequency of Meniere's attacks. And it can be used to in combination with a low salt diet in order to manage symptoms. And then as far as potential accommodations, first of all, we need to make sure that she gets an adequate time to eat during the school day. And she did let us know that sometimes there are certain meetings that take place during lunch. And if this is the case, it is important to make sure that she does have other time throughout the day to have some sort of food in order to mitigate an increase in symptoms. She can also use amplification devices. As we said earlier, she has issues with phone calls from the landline in her office. And there is real-time captioning services that can be used on landline devices that project the transcriptions right on the screen. And then in addition to that, there's other text-to-speech apps that she can use throughout her day, as well as tinnitus masking, which blocks out environmental sounds or background noises that can be distracting. And obviously in a school environment, when she's surrounded by lots of students in classes, this can be an issue. Also, she is concerned about coverage for a cochlear implant. As we said, after age 70, they're not as effective anymore. So this is something that she should start thinking about sometime soon. It should also be noted that she is unable to work with young children and students with articulation needs. As speech therapists, we need to give our clients the best quality of care, and she is aware that maybe children with articulation disorders may not be the best client population for her. And then some episodic accommodations can include the ability to leave work if necessary, if an attack gets bad enough where she cannot control the symptoms. And we have also included a plan of action form that can help sort of create a plan if these attacks do happen, and these should be stored in a confidential medical file. And then here is a handout that we made just so that you can have some information to take back with you after this talk. And that's it. Thank you.